Hi everyone, it's Tina again. I hope everyone's having a great day and sharing the awareness as much as you can this September. That's the only way that we are going to be able to beat this is by spreading the awareness and the symptoms of ovarian cancer. Now, last time I spoke about the symptoms. And we went lengthily about how everything, how you feel, how you react, where to go from there. Today I wanted to start with one question. And every woman thinks they know the answer to this, but I wanted to put it out there. Now, women, when you go to your gynecologist, and you get your pap smears and you get tested and all of that. Do you think that they test for everything? Everything. All cancers, every disease. What do you think? Well, I'll tell you this right now. For ovarian cancer, that is a no. There is no testing done for ovarian cancer when you do a pap smear. Nothing. Nothing. Now, does someone think that there is maybe another type of testing? Maybe you can go and get some blood work and they can check out to see how, your cells are doing or something, or there's, in detail of, there's a certain test, just like there's a test when you go and get a mammogram for a breast cancer and they find a lump in your breast. As painful as that test procedure is, it's in place and it helps a lot of women. Now, for ovarian cancer, is there one? No, nothing, nada. That's why, ladies, it's very important that you know all the symptoms. Now, I wanted to touch on a few things. I think it's very important that we all know our family history. And that goes back to men and women. With ovarian cancer, men, if you've had pancreatic cancer in your family, colon cancer in your family, even if it's on your father's side, or your father had it, or your uncle had it, it still can spread to as a woman, and you can get ovarian. Just like in the woman's side of the family, it's very important that you check for your breast cancer, your ovarian cancer, uterine, everything like that. Know your family history. And once you know your family history, you can kind of find out whether you want to do some genetics. Now, nowadays, which is very good because back then in 2002, there wasn't any of this, there are genetics specialists where they will sit down with you and go through your family tree in detail. That way you can really, really find out if there's anything going on. And they spend hours and hours and hours going everything, and you'll be amazed what they can find. Now, if you are not, if there's none in your area, and you can't go to one, you can also have your doctor, your oncologist test you for BRCA1 or BRCA2 to see if you have that mutation of the ovarian cancer disease. Those things are very important to do. Either whether you have children or you don't have children, for the future, your nieces, your nephews, your daughters. You can be negative as a patient of ovarian cancer. You can. I'm negative. My daughter has decided not to get tested right now. And I respect her wishes. And when she's ready, she will. It's just important that you try to do that. I know it's very hard. to go through that process. It's a very emotional process to go through. And then when you go to your doctor and your doctor says to you, and you tell him all these symptoms and stuff like that, and your doctor says to you, well, there's no testing for it. And you go, yes, I know. What's your family history? And you said, well, my grandmother had breast, and my aunt had this, and my uncle had that, and my father had that. And he says, well, that has nothing to do with ovarian. And you can, do your own research before you go to your doctor and say, well, you know what? I've read all these articles which say it does. And I know that it's not an exact test, but the CA-125 is a blood test that is taken that actually tests for your protein. And it has the protein markers on it. That way they can see if your levels are high or low. I believe it's 1 to 13, which is normal or something like that. And if you go over that, then there is a big chance that it is ovarian cancer in your system. There's also women that take CA-125s, and you know what? It comes out as a 3 or a 2 or something like that. And unfortunately, there's always 1 in a million. And that particular woman will have ovarian cancer. The next step would be to do a vaginal ultrasound, which they'll be able to look at your ovary and see if there's anything there. It is painful, especially if you do have masses there. But they'll be able to give you a better definition once they look inside you. So I do recommend that very much so. Always, always, always be your own advocate. I can't say that enough. Now, I wanted to give you a little tidbit about this disease. One of the things that ovarian cancer ladies believe is that we call each other teal sisters, and we're very strong, knit together. It's become where there's more and more of us, which is great, but we stick to each other. We talk to each other and we communicate. We kind of know why we communicate so well. Having ovarian cancer, and of course, since the disease is always detected in such a late stage, unfortunately, you do end up having a hysterectomy, and you do end up not being able to have any more children. And when you're young and something like that happens, or even when you're older, and you want more children and you can't have it, it's hard. It's a very hard situation. As a woman, we kind of think about it as, down there is our reproductive system, and we feel that, that's what makes us a woman. And when that is taken away, it's a real blow to the heart, to the emotions. And I think we're very thankful to have a close-knit community of teal sisters that we can talk to. So listen to this. Every 24 minutes, there's a woman diagnosed with ovarian cancer. Every 24 minutes. That is absolutely crazy. 1 in 75 women will be diagnosed. 1 in 75, I think I said that right, will be diagnosed. There will be 22,000 women who will be diagnosed in this year, 2016. 14,000 of them will die. Isn't that crazy? 22,000 and 14 will die. Now, what happens to the other ones that stay around? You live with the notion of, I'm in remission for a year, reoccurrence, other health issues, neuropathy, chemo brain. I'm there. Chemo brain is for real, no matter how long you're in remission. It's very sad. All of these statistics is very sad for women. And I do my best to bring out the awareness and to give you as much information as I can. I know sometimes it's overwhelming. And you may want to listen or read when you're on the bus, the train, privately. Don't do it before you go to bed, because things will be going into your head and you can't sleep. But always keep aware of your body. Always help your fellow women. Also for the men in your life, your husbands, this affects you too. And you should be listening to your wife, to your daughter, to your mother. And, you know, really concerning about everything with her body. And just read. It's out there. The knowledge is out there. All you have to do is want to read. And if you ever need help understanding something, you can always reach out to me. And if I don't know the answer, I will find an answer for you. I think that's it for this segment. And we're wrapping up with September, and I'll be back probably the end of the week or so to talk to you a little bit more. And I hope you have a great week, and I'll talk to you soon. Love you guys.